A hearty good afternoon and welcome to the session of How to Choose an IVF Clinic. We are glad to have Dr. Avani Mannam among us today to help us understand the topic. She will take us through that and more in this session today. Before we dive into the session, I would like to ask one question about egg freezing. Like, what should one avoid during an egg freezing treatment or the process?
Okay, good afternoon, everyone. I am Dr. Avani, Senior Consultant, Apollo Fertility, Kundapur, Hyderabad. Uh, the first question, because we are having a egg freezing month. So, generally, what is egg freezing? They go through an IVF procedure where your oocytes are taken out and stored. So, when we are going through this procedure of stimulation and IVF treatments, the we have to concentrate on diet and stress-free life. So basically, you should avoid alcohol, smoking, and have a healthy diet and at least 6 to 8 hours of proper rest, where you can take a stress-free life. So mostly, you should avoid stress and eat healthy and avoid alcohol and smoking. And too much of caffeine also should be avoided.
Okay, thank you so much for sharing this information. We shall now begin with the session. Doctor, you have the stage.
Yeah. So today I just wanted to tell, because nowadays we have seen that there is a quite rise in infertility in amongst the couples, among young couples also. There is lot of rising in infertility issues amongst the couples. So you have lot of clinics which have come up, and I just want to throw a light where how to choose an ideal IVF clinic and what you should keep in mind when you're selecting your doctor or clinic in when you're going undergoing fertility treatments. So first, I just want to tell who should visit a fertility clinic. Um, Generally, what is fertility? Fertility is ability of the couple to conceive, and after trying for 1 year and not able to conceive, you should visit a fertility clinic to find out if everything is fine or not. And age factor, if you're more than 35 years, after trying for 6 months, you have to visit a fertility clinic. And if you're more than 40 years, you should visit a fertility clinic immediately to find out if you have any problem. What should you do for conception? So now we have Shweta with us, where we are going to have an interactive session where we had some questions from our patients, and we can just explain you like how what are the common questions we get when you're coming to your mind, few people where you're selecting a IVF clinic, and what common questions you get to your mind. Now Shishweta, our care manager, is going to guide through us the common questions we get from the patients and public.
Hello,
Yeah.
ma'am. Yeah, the first and foremost question I would ask is how important is the infrastructure to choose the hospital?
Yeah. So this is very important when you are looking into a clinic or when you're researching regarding a clinic. The infrastructure, what do you mean by infrastructure? First and foremost, whether the clinic is equipped with all the latest equipment, like in the IVF lab. Are you able to, do you have the WHO standard guidelines followed and all the latest equipment available? That has to be checked, and the clinic is ready to deal with all kind of complications. And you have to check whether all the advanced procedures, like if I can tell you, in IVF and ICSI, the latest advanced processes like micro TISA, when the sperm is count is very low, and who do not have sperms, and for a micro TISA you need an advanced microscope which is available or not. And for the genetic testing of the embryos, where the genetic testing of the embryos is done in few indications, whether that facility is available or not, that has to be checked. And whether all the complications can be dealt with or not has to be checked.
Okay, ma'am. The next question is clinical experience is important and the embryology experience is matters to the patient and also
Yeah.
things like.
So this is also next coming to the infrastructure. This is also prime importance when you're choosing your doctor. You need to check what is the clinical experience and how they have treated other patients. You have to go through the reviews and you have to talk to people whom have already got treated there, because clinical experience is important, because nowadays we have seen that there is only one IVF cycle success is difficult. So when you're going to a doctor, the doctor should be able to identify what went wrong in the first cycle and should be able to guide you through the process, because it's very important to go through each and every small detail in your history as well as the previous reports, and uh, what changes have to be done and what tests further has to be done in you once you have failed. So the clinical expertise and experiences makes a very important role in success of your IVF. And now coming to the embryologist. See, embryologist also plays a key role in the success, as they are the persons who uh, help help to maintain the lab in ideal conditions and to form the embryos through ICSI. And they what happens is few embryologists in some clinics they're freelancing embryologists where they can spend only minimal time, so they are in a hurry and they cannot wait. But it's always better to have an in-house embryologist where they will be patient and they will do the procedure in a process, and the protocol which has to be followed will be followed correctly.
Okay, ma'am. And how important is to tell about the treatment to the patients about the IVF process and everything?
Yeah. So first and foremost, when a couple is selecting an IVF clinic, you have to research that are the treatments which are being done at the clinic being explained to the couple properly or the patient, because unless and until you are aware of what is going on with you, what is going to happen with you, you will be under a lot of stress and you will be confused. So that has to be clearly explained to you by the counselor as well as the doctor, where you know each and every step. Like in IVF, you will be having injections for 10 to 12 days. What type of injections are being given? How will be given? And how in the instructions which to be followed during the process, like how to like follow a diet or a healthy lifestyle, or the timings to be maintained, and any kind of problem that you have to contact us, all these informations, and what will happen next. Like when you start the injections, what happens, what procedure is done. Like when you start an IVF procedure, we do a scan, and then if it's normal we do a blood test, and then the gonadotrophins are started basing on the scans and hormones. So all these things, and what happens next after we start the injections, we have to guide through the couple through all the procedures, so that they are also aware what's going to happen next. They should and when the eggs are removed, what happens, and this transparency, and this is very important in a fertility clinic, because they're already very anxious and stressed, and all these things would relieve their stress, that they are in the process of this treatment.
Yes, ma'am. Is the qualified team members are important?
Yes. Now coming to the clinic staff members and the team members, where the qualification experience is very important and it plays an important role in your success. So now, as I previously mentioned, first and foremost, coming to the doctor's clinical experience and the embryologist clinical experience, and whether the embryologist is in-house or not. Then next coming to the counselor and the dietitian and the nursing staff, whether they are qualified to give the injections properly or give you instructions which are uh, whatever problem you have, whether they are attending properly, and their experience is very important, because fertility and IVF treatments are basically team. It's a team process, and everyone should be very competent and qualified in the team
Yes.
and very responsible.
What is the success rate, ma'am, for the IVF?
So when you're choosing IVF clinic, so the first thing I think comes to your mind is what is the success rate of that clinic. So when we are following all the protocols and according to the guidelines given by the bodies and everybody is qualified, definitely the success rate would be high. And you need to concentrate, also take into consideration when you're choosing an IVF clinic the success rate of that particular clinic. So worldwide standard success rate is around 45 to 50% in IVF. So you need to check whether that standard is maintained or not.
Okay, ma'am. Uh, do we have to inform the patient regarding the process, what are they going through, and the injections or whatever it may be through the IVF, while they're going under the stimulation and all? Do we have to tell them what is the process is going through them, what was the things are going with them and everything?
Yeah, absolutely. The couple has entitled right to know everything what is going to happen with them in the IVF process because once they have decided that they're going through an IVF cycle, they are stressed out and they need to know step by step what is going to
Yes.
happen with them. Like the next 10 days, what is going to happen? What's going to happen in between? Like any blood test would be there, or how many scans approximately would be there,
Mhm.
and is will they have any pain? Do they require any bed rest, or do they need to meet an anesthetist? Or all these instructions have to be given to them clearly when they come with the dates, so that they also feel that okay, everything is right and they know what they're
Yeah.
doing. So they're
Yes.
also comfortable. Basically, we have to make them feel very comfortable, and they should know what all is happening with them.
Hmm. And in-house availability of the staff and everyone should
Yeah,
be.
that is a very important question where uh, you should check whether the in-house staff is available in the clinic.
Hmm.
Sometimes what happens, the anesthetist or the embryologist or the staff, they just come for the case and go.
Hmm.
They're like freelancing. So you need to research in the clinic whether the doctors or the embryologist or the staff, they're in-house and they're available 24/7. Because when we are doing any procedures like in medicine, let it be any small procedure, we do not know when it will get complicated. So a clinic, as I told you, when a woman undergoes IVF. So, oocyte retrieval is a small process which is done under anesthesia. So, sometimes, very rarely, we encounter some complications. It can be due to anesthesia, it can be due to procedure, but the clinic should be equipped and should have a plan if any complication occurs to deal with it. So for that, you need in-house doctors and personnel available 24/7 so that we can deal with any kind of complications and patient is safe. Our first goal should be patient safety
Yes.
rather than anything else. So it's always better to choose an IVF clinic where you have all the facilities available if there are complications also.
True, ma'am. Yeah. What about the cost for the IVF? Because we will listen like different costs from different hospitals and everything. Like what would be the cost and how should we tell the patient about the cost and everything?
Okay. See, regarding the cost, it depends on what type of injections we are using to the patient, what type of condition we are doing the IVF. But most important of all is we need to explain to the couple how much is going to cost, like for each process. Uh, it's like some X amount is going to have cost for this, and this has to be explained properly to the patient and couple so that they are aware of the expenses and they can prepare. We cannot suddenly tell we are doing this procedure and you have to pay for this extra.
Yes.
So for certain amount they are prepared in their mind. That's what it should be. So the transparency of course, it's not that once they have come to the clinic, they've started the process and we go on increasing the cost factor. The cost has to be discussed in detail with them. If they don't understand, they have to be made understand as they're not into medical field,
Yes.
that all these things should be should be your cost. And now at Apollo, because we have EMI facility and as well as the insurance facility, I don't think they'll have an issue. But everything is has to be explained clearly to the couple so that they're prepared beforehand
Okay.
for going for the IVF process.
Yes, ma'am. And I would ask you the last question now. Any other key factors?
Okay. Now, when you're choosing an IVF clinic, what else do you have to keep in mind is, see whether the clinic is like, everybody is aware that we have recent ART guidelines which have been made by the government. So first and foremost, the couple has to see whether this new latest guidelines are being followed at the clinic meticulously,
Hmm.
whether the clinic is registered with the government, with the registered bodies. Previously it was ICMR registration, and for the scans it was PCPNDT, and now we have to see whether we are according to the new guidelines, is the clinic registered,
Hmm.
and all the what can I say, all the ethical and regulations are followed by the clinic. That has to be definitely checked, and no unethical practice is going on.
Good.
That
Yes.
that that's what the research has to be done, and you have to see whether the guidelines are followed. So each clinic, they maintain their SOPs basing on the guidelines which are provided and the latest researchers protocols or the latest papers. So these SOPs are followed or not. There's always mentioned that in the website of the clinics, so you need to check that whether the like the latest guidelines are being followed, or the latest protocols and latest advancements which are in the field of fertility are being followed or not. And you have to see whether the clinic has regular training sessions for the
Hmm.
fellows, because that keeps us in what do you call, with the latest research and all, because we are doing a training sessions. And you should also we need very good counselors for the patients, where their experience and their qualification matters, where they are guiding the patients through the processes of IVF and all other processes. So we you need to see the clinic whether it has other permissions from the government, such as structure permissions, fire permissions, or is it basically you need to see whether it is following all the guidelines to provide service for you. Not that the clinic is telling something on the website, it is something else uh, in person when you go and see. So you need to research in these terms, and should select a good clinic as well as good doctor, so that you are going having a very smooth journey with this IVF cycles when you plan for IVF. And now when you're planning an IVF cycle, you need to foremost check whether you have any medical issues that needs to be attended. And as I told you, you need to select a clinic which has all the services in under one roof, like you have stimulation scans as well as the OT, or the operation theater, where we take out the eggs and store the embryos, and also the anesthetist facility. Or if you have any medical problems, like you have the general physician or the general surgeon in house under one roof. So you have to select a clinic where it should be a one stop for you, where you're not going from one clinic to other clinic for one procedure.
Yes.
So the first and foremost, you select a clinic which has everything, and you just come and go finish after the procedure, and everything is under the roof. So hope that you had good understanding of how to select an IVF
Yes, ma'am.
clinic. So wish you all happy Pongal advanced, and thank you so much.